moms and women are often the chief medical officer of the house, right? The products that I build are for the chief medical officers of the house, right? That is who I focus on, the me. I'm doing all these jobs. My husband, without a discussion, just canceled his primary care appointment, which I waited 2 months to make, right? It took me 2 months to get that appointment. And he has just gone and canceled it. And he says to me, well, I wasn't going to cancel it for him, right? So he says to me, give me the number, I'm going to do it. And I'm like, no, because I just know he won't, and he'll go to the doctor's office, right? So I think it's unnecessarily difficult. There is no transparency, and there's a lot of very cool startups that are working on that problem. The move towards interoperability, where you can actually see your records. Renee is born out of that opportunity, right? Even a year ago, you had to go through a nightmare to get your records. Now, coming very shortly, your records will be yours, and they have to be given to you in a format you can read, which is huge, right? And additionally, you will see software telling you this is how much it costs to get your surgery at this hospital versus that hospital, right? Because why is that not known? When you go to buy something, a gallon of milk, it's $7, $6, right? Why don't you know how much a surgery should cost? Granted, you can't predict every detail, but you should have some idea. Why don't you know if your insurance is going to cover the experience, right? I mean, I'm still dealing with, I have fantastic health insurance that doesn't pay for anything. I don't know what it does, right? So it is unnecessarily hard. It is frankly done on purpose, because what are you going to do about it, And like I said, a lot of these insurance companies have gotten away with it, and I say it all the time, right? It's done by design. Why are there so many plans? What does this one have that this one doesn't? Why did my friend pick that one and then my employer gave me that one, right? Who knows, So I think a lot of these things are done by design. And look, I think, having been involved with so many health insurances and worked with them to do the work I did at Heal, even the people that work there don't know the answer to these questions. And half of them don't even use the same insurance for the company they work, right? They go and they get a competitor's insurance. I mean, which is what? So I think in the end, especially with how much money has poured into health tech, either these companies, these systems and payers are going to innovate and improve and share data and share records and do better to have transparency, or they're going to be eliminated. And we saw this last year, for example, Humana churned so many of its members that they decreased their guidance, right? And what happened is all these patients are like, why don't I sign up with this insurance? They're doing this for me and that for me. And everything is obvious on the website, and they're sharing my records, and they told me who my doctor is, and they gave me a black card so I can go to the gym. Why would I stick with Humana, right? This is not going to be the first time we hear this, right? This is going to happen again and again. And you see how much MA movement there is in the space, how many new MA plans there are. And very interestingly, Medicare is trying to innovate, right? They've had an innovation center for a long time. I participated in a lot of their innovation programs back at Heal and did very well. Now they're making it very interesting to keep your Medicare. Why get an MA plan at all, right?